Cholesterol, hardly any other blood value, makes people so nervous. Most doctors look at this one value first on the lab report, namely the total cholesterol. And suddenly there's uncertainty. Is it too high? Take statins? What is that? Do I have to go on a strict diet now? No more fat? But what if I tell you today that most of what you've learned about cholesterol is long outdated? What if cholesterol isn't your enemy at all, but actually a vital building block? What if medication is the wrong direction and there's a better way to do it? That's exactly what you'll find out in this video. First, I'll explain to you what cholesterol really is and why it has been misunderstood for decades. And what the new science says about it. For example, doctors from the United States of America like Dr. Stan Ekberg, and how you can practically and naturally influence your levels. Cholesterol is not a problematic substance. Cholesterol is essential for life. Your body even produces 80% of it itself in your liver. And why? Because every single one of your body cells, and we have between 30 and 40 trillion of them, needs cholesterol for your cell membrane. So the skin around every single cell, for the production of your hormones, for the production of vitamin D, for bile acid, and so on and so forth. Without cholesterol, life wouldn't be possible at all. But the point is, cholesterol is not your enemy. It shows you that something in your body is out of balance when the levels aren't right. You've probably already heard that high-density lipoprotein is good, high-density lipoprotein cholesterol, or that low-density lipoprotein cholesterol is bad. But that's too simple. High-density lipoprotein and low-density lipoprotein cholesterol are transport vehicles, not types of cholesterol. Low-density lipoprotein delivers cholesterol to cells. High-density lipoprotein returns it to the liver. What's important is not just how much low-density lipoprotein you have, but also how small, how dense, and whether it might also be oxidized. Inflammation in the body, oxidative stress, insulin resistance, those are actually the real triggers for arteriosclerosis, by the way. And cholesterol reacts to that. It's the firefighter, not the arsonist. That's really important to understand. Let's make it clear. Cholesterol is a marker and, as I said, not a culprit. The real causes of heart attacks lie in chronic inflammation, metabolic stress, and also in poor nutrition. If you only lower your cholesterol level but don't change your lifestyle, you're fighting the symptoms, not the cause. Statins, which are the medications most commonly given, block an enzyme in your liver, and as a result, cholesterol decreases because much less of it is produced. But this enzyme is also needed for the production of coenzyme Q10. And Q10 is essential for your cellular energy, especially in the heart muscle. So any one of you who takes statins because of high cholesterol should always supplement with Q10 as well. Otherwise, you risk fatigue, muscle pain, decreased performance, and even heart failure. And that's why, clearly, if you take statins, never without Q10, and even better, ask yourself if you really need these medications at all. When it comes to cholesterol and nutrition, the research is clearer today than ever before. The days when people argued about the role of animal fats are over. The fact is, too much low-density lipoprotein cholesterol increases the risk of heart attack and stroke, and it does so causally. This is shown not only by meta-analyses and randomized studies, but also by genetic research. That means when low-density lipoprotein goes down, the risk goes down too. It's that simple. And now it gets very practical, because low-density lipoprotein cholesterol increases mainly due to certain animal fats, with the effect varying depending on the type. Fatty dairy products like buttercream or cheese also contain a lot of saturated fatty acids. And while the effect isn't dramatic with moderate consumption, if you add everything up, it can become significant, especially if your low-density lipoprotein is already borderline high. And studies clearly show that if you replace butter with plant-based fats, like olive oil or even nut butter, your low-density lipoprotein can drop by about 10%. And that's without medication. And even more critical is fatty meat, especially processed meat, like sausages. Here, saturated fats, cholesterol, and inflammation-promoting substances like nitrites or so-called AGEs come together. And those who regularly eat sausages not only increase their low-density lipoprotein, but also their risk for systemic inflammation and even cancer. That's why the World Health Organization has officially classified processed meat as carcinogenic. That alone should be a wake-up call. And what about eggs now? They do provide a lot of cholesterol, but little saturated fat. Interestingly, not all people react the same way to eggs. There are so-called hyperresponders, people whose cholesterol levels noticeably increase from eating eggs. But for most people, 2 eggs per week as part of a healthy, normal diet and with normal low-density lipoprotein levels are perfectly fine. If you want to learn more about eggs, you can watch this video that I made for you as well. So again, if your low-density lipoprotein is already elevated, or if you have familial hypercholesterolemia, meaning you have too much cholesterol because you actually inherited this genetic trait, then you should definitely limit your consumption of eggs. So what exactly can you do now if your cholesterol is too high? First, replace instead of just eliminating. Swap butter, cream, and cheese for avocado, olive oil, nut butters, and nuts. And instead of red meat and sausage, try legumes, tofu, tempeh, or simply prepare yourself a savory mushroom dish. And with eggs, about once or twice a week, depending on your situation. Secondly, intentionally add what your body needs, namely fiber like oats or psyllium husks. They bind bile acids and also help to eliminate excess cholesterol. Plant-based proteins improve your low-density lipoprotein and high-density lipoprotein ratio, and omega-3 fatty acids such as those from flaxseed, algae oil, or hemp seeds not only lower triglycerides but also have an anti-inflammatory effect. My clear conclusion is that anyone with high cholesterol levels should significantly reduce fatty animal products. And that's not ideology, it's what the best available evidence currently says. A plant-based, fat-modified, fiber-rich diet is the most effective way to reduce your risk, all without medication. And for people with genetic, that is, inherited lipid metabolism disorders, even stricter rules apply. In those cases, diet alone is often not enough, but it still remains the foundation. And it goes even further. Exercise reduces inflammation. Good sleep stabilizes your metabolism. Intermittent fasting can lower low-density lipoprotein and increase high-density lipoprotein. So it's your lifestyle that matters, not just the lab results. So cholesterol isn't an enemy, it's an early warning system. And when you understand what's really behind it, you can take action with knowledge, not with fear and panic. A healthy plant-based diet, exercise, sleep, and targeted supplements like Q10. That's the way to achieve a healthy fat metabolism in your body. Don't take any medication without a real reason, but also don't go on a diet without understanding. No deprivation without purpose. And here's just an experience that I've really had over decades, namely with patients who came to my practice and had high total cholesterol. High low-density lipoprotein, low high-density lipoprotein, and high triglycerides, the neutral fats. What was always interesting was that the healthier they ate, the more their overall fat levels improved. And when people were really doing well, really healthy, so 95% eating only plant-based, then I experienced things that usually people don't believe it, but I have it in black and white. In fact, the low-density lipoprotein cholesterol was actually lower or just as high as the high-density lipoprotein. And the total cholesterol usually ranged between 160, 180, or 200. So really great. And the neutral fats were within the normal range, so it's possible. And sometimes it might take a few weeks, but then you'll see you're on the right track. You are. If this video helped you, feel free to share it. And most importantly, start right now by doing something good for yourself and putting this knowledge into practice.